So, Dr. Gebbie, I'm Hugh Tilson still, in case I need to introduce myself after over 30 years of friendship. And I can't believe that we finally have captured you in a room. I mean, you're so busy and overall everywhere for this interview. Thanks for joining this series. This is Profiles in Public Health Leadership. Lord knows you qualify. You have the best profile I know. And a leader in every way I can think of. Kristine Gebbie, thank you so much for joining me at this University of Kentucky Center for Excellence in Public Health Workforce interview, because we're going to focus on your work in public health workforce. The situation with the White House was clearly untenable, even for a clear national level public health star. Sometimes things move on, and the job of the star is to recognize when it's time to move on and do so gracefully and build her career that has moved from strength to strength. And you did that.
I did that. Well, part of what I learned...
Because one of the attributes of a public health leader is that she knows how to build a network.
Well, she also learns from each experience.
Well,
and part of what I learned is I am not a single disease person.
Well, that's true, too.
There are people who really are. They can burrow into a single disease and work on it from every angle for their whole career. And I kept trying to relate what was going on with HIV to what are we doing with substance abuse? What are we doing with primary care? What are we doing with health reform? And that would make the AIDS-only people furious with me.
Sure.
And so what I learned was I'm never going to win that battle with them. I can do something else. And before I took the job at the White House, and then immediately after, was when Phil Lee, as Assistant Secretary for Health, was really working on this whole public health systems. How do we make sure if we get health reform, we save public health? The Essential Public Health Services statement was emerging, and he knew me from a variety of roles and said, work with us on this. Right. So
you did.
I did.
And that was utterly fabulous, and out of it came the 10 essential services for public health, and from that, as you know, around that, as you know, the model standards for community preventive health services, which I've been working on, got married up with that notion that if these were the 10 essential services, you should be able to measure them.
Yes.
And here we are 15 years later, of course, with the Public Health Accreditation Board now using both models, accrediting around 10 essential services using those
chuckling because
metrics.
I think the first meeting of the Conference of Local Health Officials in Oregon that I officially went to when I was the babe in the woods in Oregon was in Eugene, where the Multnomah County Health Officer was presenting the first national standards draft to the Oregon Health Departments and saying, we really ought to learn how to use these folks because they're the up-and-coming thing.
Really?
Yeah, I can remember that document you were waving around at that time.
That wasn't me, because that guy had long flowing hair over his shoulders.
I didn't want to talk about how his hair had grown up and out. It
was the flaming 70s, bell-bottom trousers and Prince Valiant haircut.
Yes.
But moving right along.
No, I mean, that shows that people who think systems and are trying to build them plant seeds that grow, that eventually come together, because we actually created the task force that oversees the Guide to Community Preventive Services in that era, helped write the charter for that group, helped push in place the report called A Public Health Workforce for the 21st Century, the Red, White, and Blue Book. That is that describes foundationally some of the things we're still trying to put in place.
Yes.
That met jointly. I engineered some meetings jointly with HRSA and CDC. It was all around the time of the so-called Callaway meetings that we were both involved with. All of that bubbled up out of that focus on if we don't get the workers right, what the heck are we going to do with the rest of this infrastructure?
So, here we are, Dr. Gebbie, supreme public health leader, state health officer, president of ASTHO, AIDS czar, and so forth, on the rebound, going into an office where all these pragmatic insights lead you to a new career as a public health workforce researcher. That was the transition, wasn't it?
That was really the transition, because although I was working for them, I was also being heavily recruited to come up to Columbia, join the School of Nursing faculty, and help them start a doctoral program in nursing, which turned out to be a decent thing to do. But OD PHP, the HHS still wanted me working with them. So we did this half and half thing. I commuted down to Washington part of the week and worked up. But when you become a new academic late in your life, you've got to figure out a way to jumpstart something that looks like a career. Fortunately, for whatever reason, way back at the beginning, I had been coached by a couple of good academics about publishing. And so for whatever reason, I had never quit publishing. Yeah. My rate was really low during those years when I was a public health official in Oregon and in Washington and in the White House. But in fact, I kept an article here, a little bit there, a little something. So I had a bit of a foundation. But I can remember I paid visits to two friends from foundations, Dan Fox at Milbank, Nancy Kaufman at Robert Wood Johnson Foundation, and said, help. I've suddenly become an academic. The things I'm interested in don't fit big calls for grants, but I need a little help getting started. And both of them were able to give me a little bit of a jump start. And the Robert Wood Johnson Foundation thing started with just an inventory of who was doing what about public health systems. And that led me to the question, well, what are we doing about workforce? And a series of focus group research efforts around public health nurses, public health physicians, environmentalists, public health administrators, and I'm missing one, the fifth one of those five must have been health educators. Yes, thank you.
Wasn't that the world-famous Charleston Charter?
It ended up in the world-famous Charleston Charter about where we focus people. The nice thing about the way those projects played out was that I could look around the country at all my best friends in each of those 5 health professions and saying, wouldn't you like to come get together and figure out what we should do about your profession into the new century?
You did something else that I was part of Charleston Charter, I remind you, and I have very happy memories of it. But you did something that struck me as singularly typical of you as a public health leader, and that is you gave each of us our ownership, including first authorship. Well, I thought in academia your whole job was to be first author, but you didn't approach it that way. Instead, I mean, you're a credit sharer, which is a remarkable attribute, it seems to me. So I got to write the article on the public health physician and endangered species, which people then sort of recognized as a workforce initiative.